Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
And then the results came back negative, but it was a long time before she could hear the results. She was a cancer patient who
Mhm.
had just passed 5 years and started having some problems, and she had a PET scan and other tests, and she had to wait so long for the results that the agony was such that she wanted to share it with others. And I thought it was interesting.
It was,
Also,
especially what caused her fear.
huh?
I said, especially what caused her fear. I read that article.
Yeah, it was
Yeah.
interesting, isn't it?
Mhm.
Yeah, a lot of women have that in common as they wait for the mammogram results and those kind of things. And sometimes you're afraid to call, and so it becomes patient is a virtue that is very painful.
Yeah.
It's certainly good, but it's painful. There's also an article on the small changes that can ease your body aches. Talks about how you position your desk and you set up your work and have your things seated about an arm's length from your monitor, your shoulders relaxed, and uh, 90-degree angles, all that stuff. I don't know how many of you take advantage of it, but as you age, I guess it becomes more important. Also, if you're going to use a chair, you should use something that is comfortable uh, so that you don't fall or anything. And then reading, talk about keeping it so you can read easily without neck pain, which is something that after you in a position for a while and it's not good, you can have neck pain. And then if you're watching TV, it talks about putting a pillow behind your neck, and also when you sleep, have the pillow to be supportive, the natural curvature of your spine. And then don't sit still for longer than 20 minutes. And if you do, then you need to get up and move around, especially if you're in this group meeting.
Mhm.
Anyway, those are some of the things that they talk about. They also talk about the fact that they have suicide centers which allow you to talk to people, and it has markedly decreased the rate of suicide in most states. And I think that's good to know that these interventions that have been used over time are working. So uh, I've had a lot of interesting discussion with my medical students who are poorly equipped to deal with suicide. And well, the most important thing is not to leave them alone and to get them in contact with somebody, whether it's the suicide prevention number or the psychiatrist. But I don't leave them alone and don't leave them without uh, taking them to some place that they can get help. Uh, anyway, I just wanted to share those thoughts with you before we got started. Any comments about those interesting aspects? Okay, if not, I guess we can start with the many articles. Would you guess that this thing is now? Isn't that interesting? What an interesting article. Doing this one thing every day can lower your cancer risk.
Hmm.
That simple thing is walking. That's amazing, isn't it? Something that simple that can lower your risk for cancer, whether it's 10,000 steps or not. And as a matter of fact, Most of these people didn't take 10,000 steps, they just walked. And, you talk about the fact that don't drink, don't smoke, and don't eat red meat, which may be difficult to do, but walking is easy to do for many people as long as you don't have uh, bad knees and bad ankles. But this is actually from a UK study, interesting. But uh, it's amazing that those who had the 10,000 steps had a even lower risk, but walking to any extent lowers their risk of cancer. So that's something that almost everybody can do. We say almost everybody, but there's some people who have bad knees and they have bad ankles and other things. So not everybody can walk, but those that can should. Any comments or questions about this article? Darryl.
Yeah, some people don't walk because they got a bad back or painful back, but walking actually helps improve back pain. So, if walking can prevent cancer, but you got a bad back that's in your way, go ahead and walk anyway.
Thank you. Any other comments? Yeah, John Buchanan.
Yes, I noticed that same thing with my shoulders. Um, I used to have bursitic pain in both of my shoulders, and when I started going to the gym and exercising, the pain was lessened, believe it or not. But swimming, I thought I was going to have that pain swimming and the pain in my shoulders, but the more I swim, the less pain I have. It's kind of strange. Um, and the other thing is that uh, walking, I used to do uh, going to the baseball games. I catch the metro, right? And there's a lot of steps in that metro. My doctor told me to avoid going down the stairs because of my knees, right? I don't know why she said that, but walking up the stairs is that's a heck of an exercise. If you ever tried it, walking up the metro escalator, to the left, man, whew, I come out of there with sweating, really. But that's really good.
Thank you for sharing. Any other comments? If not, let's go to the next article. Let's put this one in there because most of us old people have already had measles shots when we were very young, and so uh, I thought many of you may be wondering, since measles is so contagious, and since we have so many new measles cases, and this article addresses this and tells you who should get another measles shot, and it's pretty clear. If you've been immunized uh, appropriately, then there's uh, little chance of you getting measles. But if you have these four issues, and if you were treated for cancer or were a transplant patient, things might be a little different. Uh, but I guess it emphasizes that measles is one of the most contagious diseases you could have. And so if you're in an area that has a lot of measles patients, then that's an issue. But it identifies those four categories of patients who might need another dose. Uh, and most of us who fit into the category of those who had received the adequate measles dose. But it does mention the other categories of people who, uh, because of the fact that they have had cancer and have had aggressive cancer treatments and if you're immunosuppressed and on immunosuppressive medication, and you're in an area that's full of measles patients, then there's food for thought. But for the most part, people who our ages who got vaccinated with the MMR vaccine uh, don't need it. John McKenna.
Is the measles vaccine a single dose?
Actually, it's 2 doses.
Okay, so
Yeah, yeah, but it's usually, but of course, that's before you're 5 years old. That's when you get it. Yeah.
okay, I wouldn't remember it.
Yeah, and after chemotherapy, you could be exposed, and it also mentions the category of patients who have are immunosuppressed because of transplantation with steroids and those drugs uh, are also susceptible. Yeah, the consequence. Betty, did I see your
Yeah.
hand up?
Yes, good morning again, everybody. Um, I know just about probably everyone on this call had their measles shots when they were young. I think we had to have them to go into school. So that that is sufficient for us. That's what you're saying.
Yes, that's right.
All right.
And that should be adequate.
Okay.
Uh, as I said, unless you fit into the other
Mhm.
category in which you had extensive chemotherapy and you had extensive immunosuppression treatment for transplantation. Those are people who are exceptions to the rule. Fortunately, the measles outbreak hasn't reached here yet, and it may not, but so uh, this may be of no merit to us, but uh, there's no official recommendation that you need a third dose, so keep that in mind.
So Kennedy is saying mandated vaccinations are bad. Mandated vaccinations, like what Betty was just saying, we had to have it in order to go into school. He doesn't want that, right?
Yeah, that's correct. That's what he's alleged to have said. Yeah, of
All right.
course, we don't agree with him. But, okay, any other comments or questions about this article and the measles outbreak, which is now up to 700 now? Okay, let's go to the next article then. This is something we've talked about for some time, the importance of getting urine test scripts that can be done to, especially for people of color who are over 40 years of age, because the likelihood of getting kidney disease, especially if you're a woman over 40, is extremely high. And therefore, part of your physical should include a urine test for proteinuria. And this test is particularly diagnostic for proteinuria and albuminuria, if you have the protein uh, uh, creatinine ratio or the albumin creatinine ratio. And this is, if you've got protein in the urine, that means that you need to be followed because that's one of the earliest signs of kidney disease. It's not an elevated BUN or creatinine because that's much later. The earliest sign is when you have a urine screen that shows you have protein in your urine. That's one of the earliest signs of kidney disease. And the earlier you make that finding, easier it is, more likely it is for you to have a reversal of whatever's causing the kidney disease. So it won't turn into end-stage renal disease. So I think this is something that should be added to the physical that you get after you're 40, uh, so that you can make an early diagnosis. Often this is not done. And since we have an increased rate of kidney failure after 40, particularly in women, and people who are overweight, then this is something that if when you get your annual physical, if you're not used to getting this done, you should add this to the test that you ask your doctor to get for you. Dr. Buchanan?
Yeah, you already know my question. How expensive are the tests?
That's cost about 5 cents. Yeah, it's not costly at all.
Sounds
And
good.
most of the screening we do is free. Darryl?
I think we mentioned in an earlier session that protein in the urine sometimes causes foamy urine, foaming or sparkling urine, decreased appetite, trouble sleeping.
Yes, thank you for sharing that again. That's often the first sign is that you, as you mentioned, you have foamy urine. Uh, that doesn't always mean that you have proteinuria, but if you have foamy urine, you should be tested for protein because you more than likely do. And that's the earliest sign for kidney disease.
So is this test one you have to request?
If your doctor does not order it for you, yes. If your doctor orders it for you, then you just then fine. But if not, you should request it. And if it's negative, wonderful. If it's positive, then you should uh, see a kidney specialist. Uh, if the first test is positive, you want to repeat it again, that's okay. But if it's positive twice, then you should actually see a doctor so that you can uh, find out what's causing it and see if it can be reversed. Uh, Stage 1 and stage 2 uh, kidney disease are reversible, which is stage 4 is not, and stage 3 isn't easily reversible. Yeah, but stage 1 and 2 are usually reversible. Okay, no other comments or questions. We'll go on to the next article. This is a identification of a new chronic kidney disease gene that it's a pancreatic progenitor cell differentiation and proliferation factor that apparently is a risk factor for chronic kidney disease. This is a new finding, and how this will play itself out in terms of its identification causing us to make things different remain to be seen, because this is just something brand new, but it's something that you might be aware of so that you know that we're finding new things. We already know uh, that there's certain proteins that when they're found that they uh, put you in jeopardy for kidney disease, and we think that's why more blacks have kidney disease, uh, and so that there's a genetic association with kidney disease and why we have more kidney disease than other people. And I think this is a new development that will help us to identify risk factors for kidney disease. Next slide, please. Next, yeah, next article. Now, this is something that you may not be aware of, but that FDA has approved uh, uh, pig kidney transplants. And so that study is now moving forward. Uh, we've had 4 kidney transplants from pig kidney transplants. 2 of them have survived and are still doing well now. Uh, uh, the first 2 actually expired. That did die. And the last 2 are out of the hospital and home and doing well. Although the survival is not longer than 6 months, but it's still something. And this is made possible by the fact that they use CRISPR-Cas9 technology to remove the uh, genomic parts that cause pig kidneys to be rejected. And so this also activates the porcine retroviruses. And uh, since the last 2 kidney transplants are surviving, it's going to be interesting to see what happens with the next 40 transplants. And of course, this then is experimental, and uh, insurance will not cover it. So, uh, uh, for the most part, these transplants will be done for free. Any other comments or questions about the uh, getting a xenotransplant? That is a kidney from a pig. Now, this is primarily reserved for those patients who have a lot of antibodies, and therefore they can't get a human transplant because their bodies are sensitive to it. And so these patients are the ones who are most likely to get these kinds of pig transplants because they can't get a human transplant. And that has been the criteria they've used for giving transplants to the previous patients. These are patients who had so many antibodies that they could not get a human kidney, and so they had to receive a pig kidney. Any comments on this very interesting aspect of life? Betty?
Yes. How long the 2 that have survived, how long have they lived since their
One is about 6 months. The other is about 3 months.
and the 2 that passed, how long did they survive?
About uh, less than 2 months.
Oh, okay. Okay. Okay.
Any other comments or questions about xenotransplant, which are predominantly pig transplants, which are specially treated and prepared to decrease the likelihood of rejection and also the transmission of any diseases. John Buchanan.
Yes. They mentioned preeclampsia. You know what that is?
Yes, preeclampsia is when you have hypertension after pregnancy. And we know that if you have eclampsia or preeclampsia, that you are more likely to get hypertension and later on have high blood pressure and even also kidney disease. John Tatum?
Yeah, I had a question about the xenotransplant. It seems like the failure rate is high in terms of months. Um, so would that, is that, the question is that the xenotransplant, is it on the increase? I don't think it would be on the increase if that failure rate is so high.
That's why they're having, as I mentioned, that's why the FDA is now approving an experimental uh, situation in which they've approved to have pig kidney pig kidney transplant. It wasn't approved before, and now it's approved for experimentation. So we're going to see in the next year or 2 uh, a number of pig kidney transplants that will be studied, and if results are Okay, then we'll move forward with that as a clinical armamentarium for kidney transplantation. But that is not the case yet. This is still too early for that. Any other questions on this new step forward uh, that is going to be studied over the next 2 years? And this points out the need. At least 17 people die every single day because of the shortage of donors. It's 100,000 people on the waiting list. And we need to do something so that those 16 people don't die every single day because of the fact we don't have enough human donors. Any other comments or questions about something? I think we asked last week, shortly thereafter, how many of you would, if your life depended on it, would accept a genetically edited pig kidney? And if your life depended upon it, most people would. Some wouldn't, though. Any comments or questions about this new experimental kidney transplant that is going to be taking place over the next 2 years?
Dr.
Darryl?
Callender, um, I'd like to,
Darryl?
Yeah.
Darryl?
Um, I think this pig kidney transplant is FDA approved for clinical trials, which means that insurance will cover it.
No, 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 no. Insurance
No.
doesn't cover it until it's no longer experimental. It means that the uh, people who are doing the transplant will not charge you. That's what it means.
Oh,
It
okay.
doesn't mean insurance will cover you. Insurance
Got
will
it.
only cover you after it is no longer experimental.
um, Dr. Callender, I'd like to hear
Yes.
from Constance, who's on the line. Uh, Constance, what's your feeling on this article?
Constant.
Constance,
Um,
please, yeah.
I feel that it's it's a great option if you don't have any other alternatives that might work or fit for your situation.
Thank you for sharing. Any other comments or questions or issues about something that is becoming something that uh, something that may well when kidney transplant first started out, this is exactly the way it happened, and then it was experimental, and then after it was proven to be successful, then it was covered by insurers. And it'll probably be the same way in this situation. So 2 out of 4 isn't that great, but it's a step forward. Okay, let's go to the next article. This is an article that was critical of the new changes in liver transplantation, in which we tried to get organs that are transplanted available to the closest place, close to where the recipients are. And it has been very successful in doing that. However, it has created a problem in those areas that are far away. And this article says that the mortality risk is higher in those areas that are far away. And they are requesting to do something about it. This is the first study that's identified that low population size areas are more likely to experience mortality and dropout. And this is something that suggests that the uh, suburban patient is more likely to die needing a liver transplant than somebody who's closer to the urban population. And this is a new study that's just been identified. And so it'll be interesting to see what happens. As you know, the organ procurement transplant network is undergoing radical changes in an effort to make it more equitable. And so this is one of the challenges that they're facing. Any comment?
Yes, Dr. Callender, I missed it. What's the MELD score? What does that mean?
The model for end-stage liver disease, which is that if you have a high MELD score, that means that you would die if you don't get a liver transplant. If you have a low MELD score, then you don't need a transplant because you wouldn't die. So that those people who fall in the category of high, well, those are the ones who need the liver transplant. And if you need a liver transplant and you live far out, live in a far suburban place, they're saying that the likelihood of you dying before you get a liver transplant is greater. And so we need to, while we've done something to help those patients in the urban areas, we need to do something to help those patients who are in the suburbs and far away. And that's what this article is all about, begging for help for the suburban patient as well as the urban patient.
Mm.
Any other comments or questions about this article, which demonstrates a need? And the model for end-stage liver disease is a model that looks at the kidney function, the liver function, and has identified those patients who are at high risk for death and those patients who are at low risk for death. And those patients who are at high risk for death are the ones who need the transplant as soon as possible. Let's go into the next article. There's no comments or questions. Now, we've had a couple of articles that have dealt with the fact that obesity should be considered a disease just as seriously as diabetes and cancer and all the other diseases, and shows how it's linked to 16 other cardiometabolic diseases, but is not actually considered a disease itself. And this is something that should be corrected. I think Darryl has pointed out that more than 50% of the American population fits in the category of overweight or obese. And so we need to recognize that this is obesity is a problem that is killing us, and as such should be recognized as a disease entity in itself.
How are you today?
And so this is what this article is about, saying that its association with the other 16 metabolic diseases mean that it's a public health crisis that forces us to really recognize obesity as it is, which is a killer. It's 11-fold increased risk of obstructive sleep apnea, which itself is causes cardiovascular diseases, and so a BMI of 30 and above is very serious. John Tatum, John Tatum, and then Betty Blair.
Yeah, what's the specialty for a doctor who handles obesity?
Bariatric medicine or bariatric surgeon? Bariatrics. Betty?
Yes, I'm just happy to report that I remember some time ago, I told you guys that I was on that not eating after 4 o'clock to lose weight. And when I stepped on my scale yesterday, I weighed 142 pounds, and I can't even remember the last time I weighed 142 pounds. So even though my 5'1" frame, they still may consider me obese or going or headed that way. I'm definitely headed in the other direction.
Congratulations. And there's an article that addresses that, which we'll discuss later on.
Okay.
Any other comments or questions?
Yeah, one other question on that same subject, bariatric surgery. Um, would that fall under the gastroenterologist?
No, gastroenterologist is different from a bariatrician. Gastroenterologist just deals with the GI tract. Bariatrics is dealing only with those people who are overweight
Okay.
or obese. And they actually uh, consider it obese. They take care of the obese patient rather than the overweight, because there's difference between overweight and obesity. 25 to 30 BMI is considered overweight. Obesity is over BMI over 30. Pearl Lipscomb first and then Darryl again.
Yes, I just thought I would share something that happened to me as I have had kidney disease for a while. And I recently had an appointment with my kidney doctor. In fact, it was last week. And uh, he told me that my kidneys had improved quite a bit. And he asked me what had I been doing differently from what I used to do. Well, at one time, I guess I was what one might consider obese, and I have lost quite a bit of weight. And I also told him that I had started drinking more water and eating less meat. And he told me that I should continue doing that because that my kidneys have greatly improved to the fact that I don't even need to see him twice a year as I had been doing. He just told me to check back with him in a year.
Great news. Congratulations.
Thank
Darryl,
you.
Darryl's
Yeah,
next, and Darryl's contributed mightily to that, I'm sure.
okay, yeah. Betty, you're only slightly overweight. You're not in the obese category. You're almost there. To get into healthy weight range according to BMI, you just got to get down to 133.
Very good, very good. I'm working on it.
Congratulations. Okay. Any other comments or sharing? If not, let's go to the next article. We've kind of talked about this for quite a while now, because we have recognized that GLP-1 drugs do a large number of things, and this article talks about what it can do. It talks about the fact that, as we've said, it's the wonder drug of 2020s, which involves the treatment of diabetes, obesity, uh, inflammatory neurodegenerative diseases, and a host of others. And it talks about its mechanism of action. And it's a hormone created by the intestine. And it enhances insulin secretion, suppresses glucagon releases, which does the opposite, which increases the blood sugar. And it also delays gastric emptying. And so the GLP-1 hormone tries to control the blood sugar and keep your hemoglobin A1C where it belongs, 6 or less. And these hormones, of course, decrease weight gain. and they act at the brain level. They modulate the appetite centers and reduce the cravings to eat. That's just one of the things they do. And what we're finding out now is that it not only does this, but it also slows gastric emptying, increase your early satiety of feeling full. But then in addition, it treats the cardiovascular system, which means that it reduces major cardiovascular events, which are independent of weight loss. And this then is very important. And as we go down, we find that not only does it do that, it also affects, as you go down, you can go down, you see that it affects, it's anti-inflammatory. And this is another aspect of it that is good. Of course, obesity is an inflammatory process as well, but it decreases, it improves the heart ejection fraction, and it also decreases the likelihood of arteriosclerosis. Um, and then, of course, it has an anti-inflammatory effect that reduces joint pain and inflammation. Then, in addition to that, it addresses the kidneys and the liver, so that it's the actually only new treatment that improves liver function in a way that has never been seen before. So that renal disease is helped, as is kidney disease. And then this is relatively new, is the ability to minimize brain disease in Alzheimer's and Parkinson's, although it doesn't, has not yet shown to uh, modify Alzheimer's yet. We have studies in place that show they reduce the amyloid plaque and protect against some of the dysfunction of Parkinson's disease, although a lot of these studies are in process. And then, of course, the most recent findings are the fact that it treats alcohol and heroin addiction as well. And so psychiatric disorders and cravings for addictive substances are reduced, which is one of the more recent findings. And then it also can help with other GI gastrointestinal problems. And so you can see that the GLP wonder drug has identified abilities to help in many organ systems. And so this is something that opens up a whole group of ways in which the GLP-1 drugs can be helpful for not only obesity and diabetes, but a panoply of disease entities that go from the head to the toe, almost. And the safe use of it becomes very important. And then, of course, okay, Betty, you have a comment, a question?
Yes. Is Jardiance, do I remember correctly? Is Jardiance considered one of the GPL drugs?
GLP-1 drugs, yes.
Yes. Okay. My husband was taking Jardiance for his diabetes, but I think she switched him to something else. So I think I'm going to try to see if his Jardiance is going to help me lose some of this weight.
Well, I think you should stick to what you're doing.
Oh, I'm going to keep doing that.
Yeah.
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 Okay, any other comments or questions about this new wonder drug?
I think I need to take one a day.
I think you've done well, and you might leave well enough alone. Any other comments or questions about this drug that has not been fully identified the extent to which it can be helpful? And it may well be. I know Dr. Perez may not be with us because she's traveling to California with their grandchildren, but she's talked many times about the fact that when you do particular studies in the Black population to find out how we can use this optimally. Any other comments or questions about the GLP-1 drug?
They sound like vitamins.
I'm sorry?
They sound like they're vitamins.
Well, it's not a vitamin, but anyway. Okay. Any other comments? If not, we'll go to the next article. Now, this is it's interesting to follow this with this CMS decision to remove obesity drug coverage from the final rule in 2026, when we find that we do have an obesity drug that works, and that GLP-1 drug works for diabetes, and it's covered for diabetes, but it is not covered for obesity. And this has caused a lot of societies who take care of and treat obesity to be very concerned, because it should be included in that, but it's not. And I think we're going to see a lot more things like this as we see the changes that occur with the new administration. So they are complaining. We'll see what happens. It does seem a little strange that with the success of these drugs for the management of obesity, that it wouldn't be covered, but that's the way it is. It's interesting we're having so many changes with the new administration. Nothing staying the same, which is something that people generally don't like change anyway. So since new administration is changing everything, you have many people who are very unhappy about many things. Any comments? If not, we'll move on to the next article. This is an article that may be of little interest to this group because we now have a fifth type of diabetes. One is like 1 and 2 are not enough, but there's 3 associated with genetics, and now there's type 5. The type 4 is gestational. It means when you get pregnant, you get diabetes. And then type 5 is malnutrition. In some countries, first we have in Jamaica, malnutrition-related diabetes, the lack of protein. And this is a very new diagnosis. So that the 5 types of diabetes. Type 1 is insulin, is diabetes without insulin. Type 2 is diabetes where you have insulin resistance. Type 3 is the genetic form of it. Type 4, and now type 5. So it doesn't matter. Diabetes may be diabetes, but anyway, this is what's going on in the field of medicine. So at least you're advised that there are 5 types of diabetes now. The one we're used to dealing with is type 1 and type 2. Type 2 is the one that particularly affects people of color, in which they have insulin resistance. They have insulin, but the insulin they have is not lowering the blood sugar. It was just for information only. Next slide, next article, please. And this is many people are taking for depression, taking SSRIs drugs, and as such, one of the things that they have as a side effect is insomnia and tremors, invariably tremors. And when these medications are stopped, the tremors, for the most part, will go away. But since you have many people who are treated for depression and other reasons, it's important to know if you have tremor and you have yawning, that these are some of the side effects of SSRI drugs, which are primarily used for antidepressant. And since depression is so common, it's something to keep in mind. And Darryl?
Yeah, didn't last week we talk about antidepressants can cause cardiac arrest?
Yes, that's correct.
And SSRI, that's the same category of antidepressant that
Yes,
could cause cardiac
exactly.
arrest.
Exactly.
Yeah.
Yeah.
Another
Yeah.
side
So
effect of these antidepressants is suicidal thoughts. So, okay, you're not depressed anymore, but you're thinking about suicide. That sounds depressed to me.
it sounds like very depressed to me too. Yeah. So uh, it, and there's an article that also talks about the electrical treatment of depression when it's resistant to other things. And there's also another nasal drug that we'll encounter that's also treated for treatment for uh, resistant depression. Serious business, yeah. Depression is more than a notion, yeah. And the worst thing is to not treat it at all. And then, so, so if you treat it, you got problems. If you don't treat it, you have problems. Next article, please.
Um, Before the next article, you got these psychologists, psychiatrists, when they get depressed, I guess they have to go and see a psychologist or a psychiatrist.
What was your comment?
Psychologists and psychiatrists who have depression should go to a doctor, a psychiatrist or a psychologist for themselves.
Yes. Okay. All right.
But the point is, a lot of them are depressed because of um, the issue with drugs not working for their patients and their treatment not working for their patients causes depression sometimes, I guess.
Yeah, there's a lot of concern that psychologists and psychiatrists need help themselves. Yeah. Yeah. Now, this is a diuretic that um, has shown to increase kidney stone recurrence, which is new uh, because hydrochlorothiazide are very commonly used for the treatment of hypertension. And this study shows that while they do cause diuresis and are helpful in management of hypertension, they also increase the likelihood of kidney stone, which is a new finding. Uh, so have to keep that in mind. Kidney stones are bad enough, of course. Uh, in many ways, hydrochlorothiazide was one of the earliest drugs that was used for the treatment of hypertension, and has been associated with hypokalemia. But this is the first study that's linked the chlorothiazines with increased risk of stone recurrence. And this author is thinking that hypothermia is the problem. Hypokalemia is the reason. Well, I don't know. We need to have more studies on this to find out why you have the increased incidence of kidney stones, which is probably one of the most painful conditions known to man. John Buchanan.
Yes, Dr. Callender, what is the treatment for kidney stones?
Oh, treatment kidney stones, you take them out. You try to use them to drink plenty of water and diuresis, but the treatment is to remove them surgically, usually. Very often they'll pass themselves, but if they don't pass themselves, they have to be removed surgically. They cause so much pain that if they do not pass on their own, they will have to be removed
So
surgically.
what treatment might they use prior to surgery?
That's the treatment of choice. You give them plenty of water and give them a chance to pass it on their own. If they don't, then you surgically remove them. Janice?
I know that it's extremely painful. You ask someone that's got that pain to drink water, how long do you wait?
You don't wait too long. If they don't urinate, if they don't pass the stone within some hours, then the surgical treatment is appropriate.
Okay.
Janice, you had your hand up?
Yes, I know several months ago, my sister experienced that. She had kidney stones, and apparently she was passing it. She didn't know what was going on, and extreme pain. We had to call the ambulance and everything, extreme pain. And they said that's what it was. She was passing it. And this went on for a while. It just didn't pass and it's gone. And eventually she came home, and then several months later, she thought that she was having another episode and it wasn't as bad. Went to the doctor and was tested. Oh, yeah, it's another kidney stone. Well, she didn't want to go through that. They were able to do something laparoscopically where they crushed it somehow, and she's relieving herself of it piece by piece. But whatever that process is, it was a lot better than the first one. And I mean, I was with her. It was extreme. We didn't know what was going on. So it's something very painful.
It's thought to be the most painful condition known to man, although the question is which is more painful, having babies or
Exactly.
having kidney stones.
She said it was worse than having a baby.
Yeah.
Yeah.
That's what
So
people
even the
say.
paramedics in the beginning, they weren't quite sure what was going on, but the way she was screaming, they knew they had to take her out of there. But whatever procedure, this was just a couple of weeks ago, the laparoscopic thing. And every now and then she'll get a sense of something is happening, but they said she'll relieve it on her own. So she's still in treatment for it, but that process is a lot better than what she went through the first time.
Well, it's not better than having the stone removed, which is may sometimes be the only treatment. But
yeah, and I'm saying laparoscopic might have been laser, I guess.
To crush it so that it can be removed itself is another treatment. Yeah.
Right.
Yeah. Betty?
Yes.
You're on mute. You're on mute.
Okay. I'm sharing something that my husband went through. He messed up one of our anniversary trips. I came home from shopping and he was on the floor. And at first I thought he was kidding because I've been gone too long, but he was in pain. And I had to take him to the hospital and they said kidney stone. And I don't know how many hours and hours he stayed there, but he finally did pass it. And he said, when they showed it to him, he said it was about the size of a grain of pepper. That's how small it was. But he said that the doctor said the pain is just like giving birth. So, but
Yeah.
he hasn't had any incidences since that. But he remembers that vividly.
Thank you for sharing. Any other comments? Yeah. Let's go to the next article. COPD is an issue. It's interesting that this article says lung function decreases about 50% from age 25 to 75, and that the COPD is associated with the aging process, and that the older you get, the more likely you are to have COPD. And although this is not helpful in terms of because as you age, that doesn't mean that as you age you're going to get better. It suggests that as you age, you're going to get worse and you have more COPD. So this article doesn't really come up with any positive solution to it. It just says that the older you get, the more likely you are to have COPD. But it doesn't really identify ways in which you can actually, as you age, to eliminate or reduce the likelihood of COPD. And of course, COPD is associated with smoking and consequences thereof, but whether it's secondary smoking or the actual smoking itself causes many impacts upon the mitochondria, which result in lung tissue damage. And all of these processes result in you having COPD, chronic obstructive pulmonary disease, which results in your inability to breathe, need oxygen, and cause death. So anyway, this is not very helpful, but it just identifies the aging process and the inflammatory process as being partly responsible for COPD, which I think I was looking for something in this article I'm going to talk about what we could do to help with it, but most of it was not helpful. John Tatum?
Yeah, my sister had COPD and emphysema at the same time.
Right. Mhm. Which is a lethal combination. Yeah. Okay, let's go to the next article and hope we learn more about how to of course, everybody will tell you stop smoking, but by the time they tell you that, it may be too late because if you smoke for 20 years, then the damage has already been done. Now, this is an interesting article that for the first time, a wristband has been successful in treating tremor, where your hands shake all the time. And there have been medications in the past that have been used, but now we have a wristband that significantly reduces the tremor and shaking. And so uh, I know John Buchanan's question, we don't have an answer to. How much does it cost? But certainly this is a new product that works. And it's going to be interesting to find out what actually is the cost of it. But this article doesn't answer that question.
If it's an Apple Watch, it costs about $300.
What's that?
If it's an Apple Watch, it costs about $300.
Oh, okay. $300 isn't much for something that would decrease tremor. It has not yet, though, been approved by FDA, but apparently the initial studies show that it's very effective.
That'd be cool to have Medicare pay for my Apple Watch.
Well, I think it's going to cost more than $300, but we shall see. Trauma can be a tremendous obstacle to painting, and of course, if you're a surgeon, it's even an even greater obstacle. But so many ways that this could be helpful to a person. Okay, now, if there are no other comments, let's go to the next article, please. This this is an interesting article that compares common conditions based on recommendations from physicians and from artificial intelligence. And it indicates that AI was superior to the physicians in terms of its recommendations. And this is one of the reasons why some people are fearful that AI will take the place of physician. Although I think AI will make the physician even better than they were before. So artificial intelligence is here to stay. The question is, how do we make it appropriate and equitable at the same time? Any comments or questions about artificial intelligence? We know that it is going to take people's jobs. The question is whether it's going to take physicians' jobs. And that verdict is still not out yet. But these are more studies that are showing that there's a place for AI in science and in all aspects of life. John Buchanan?
Yes, Dr. Callender, I've always wondered with AI in general, who puts the information in AI to begin with?
And there are a number of ways in which people put information into AI. There are some programs that they have people from the community as participants, and there's some programs where they do not. So it all depends on who's doing it. And one of the concerns is that with the new administration's dislike for diversity, that you may have less diverse inclusion and therefore a more biased AI. But up until recently, there was a lot of diversity in AI, with people from the community being represented. And many of the chat the chat the chat AI involved diversity and people from the community to help put the data in. Because without that inclusion, the bias in, bias out. Any other comments or questions about AI and how this will be impacted by the new administration? With the anti-diversity emphasis, it would seem to me that it would move AI more to the side of bias than it would otherwise be. But we shall see. John Buchanan? No. Did you have your hand up, John? No.
No, sir.
Okay. Well, moving on to the next article. This article shows that this new drug, quetiapine, outperforms lithium in resistant depression, something we've been talking about today. And lithium was used in those cases where depression was resistant to other treatments. And now we have this other drug that outperforms it. And since depression is so common and so associated with so much morbidity and mortality, having drugs that are successful in remedying depression becomes very important. We've seen many examples where people who stopped treatment for depression became suicidal and killed themselves or hurt themselves and others. So the treatment for it is very important. Any comments or questions about depression and its treatment?
Yeah, Dr. Callender, I've always thought that okay, here's a new drug. When do they actually figure out the effect, the long-term effect? Then then it take years and years to find out, if these things have down the line negative results.
Well, that's a common concern about all drugs and all interventions. The short-term information becomes easy to obtain, but what are the long-term impact? And that's not as easy to get, and that takes time, as you say. And so short-term, yes. Long-term, we have to wait it out. Any other comments, though? Okay, let's go to the next one. Now, this is back to Betty Blaylock talked about her intermittent fasting and how that outperforms daily calorie cutting for weight loss. And this talks about programs over 12 months in which they emphasize calorie cutting and then they emphasize just intermittent fasting, having a daily food intake 8 to 10 hours on most days, like Betty's talking about, and how that really was better because you didn't have to worry about what you ate or drank, but rather the time you ate or drank it. So it does appear that the results show that the intermittent fasting works better than just calorie cutting. Any comments, Darryl?
Yeah, intermittent fasting can be as simple as just skipping a couple of meals a week. So, say for instance, on Sunday, you could just eat 2 meals instead of 3, or whatever your comfortable days are.
Right, and that's what makes it easier. And so, any other comments? Betty already made her comments. It seems that it works for her well. So, and I think that Darryl's sharing helps us understand why. Any other comments? If not, we'll go to the next article. This article didn't make too much sense to me, but Black children without and with viral infection had more parental racial discrimination. Didn't quite understand why she even did the study, but she seemed to understand it. Black children who came to ED for acute respiratory and tested negative faced more racial discrimination than those with an infection. I didn't quite understand the significance of it, but she did, and maybe you do. I was at a loss to see what difference it made. We people of color recognize that stress goes along with our complexion, whether we have an infection, viral infection or not. Uh, Color is the dominant theme for many people. And so when they see us, uh, they get stressed out and we get stressed out. So uh, it's interesting that what these finding didn't quite impress me, but I thought it was something that she was so impressed with it that I thought it should share it. Maybe you'll understand it better than I, because I think the big issue is the fact that we're people of color, and with or without an infection, uh, we face racial discrimination. So, but anyway, I'd like to hear your thoughts on this song. No comments?
This is one article I wish I had read the article really before we got on. Maybe I could, but just to
Well,
scan it isn't helping me much. So
yeah, I read it in detail and still
do you do, huh?
didn't
Okay.
understand why she thought it was so important. Although, if you look at it from the perspective that people of color are discriminated against, uh, whether they have a viral infection or not. Uh, but this study says that they were even more discriminated when they didn't have a viral infection, which is interesting.
Yeah.
Yeah. Well, okay.
Why did she write this article? Was she trying to get a grade or just to write?
I can't answer that question for her. She she'd have to answer that one for herself. But she felt that it was an important article. Okay, no other comments. Let's go to the next article. This is sad to say that after all this time, gender inequities in academic medicine haven't changed. And we have more women represented in medicine, but still not very many women at the top. We've been aware of this for people of color for some time, but it was the hope and expectation that as you got more women in medicine, that you would have more women in leadership positions. But unfortunately, that has not been the case. And this article demonstrates that the, the misrepresentation of women in the top positions remains unchanged. And the question is, what else can we do? The issue that I feel is that people of color have started efforts that result in changes in many things, and women are taking advantage of that. But uh, sometimes it's overlooked that the Black male is just being eliminated. When we look at what's happening with education, that's going to impact the Black male more than any other ethnic group. And as women are becoming more confident, I'm all for women being in top positions. And I don't have any problem with that. But I do recognize that people of color, particularly Black men of color, are being eliminated almost to the point of wondering about uh, elimination of the Black male or decreasing it to such a number that it becomes genocide. Anyway, but that's not the purpose of this article. The purpose of this article is to show that even though we have more women in positions, they are not at the top, and they have every right to be. But so they need equity in salaries and also equity in terms of being at the top positions, which has not been the case, in spite of the fact that you have more women in medicine, many more women in medicine, in medical schools, and many more women in surgery, many more women, but rarely do they get the top positions. What's to be done about it? That's a good question. Anyway, that's what this article is all about. We look at the department chairs, the deans, the presidents, and so forth. They are much less likely to be women. Any comments? So there's no surprise, though. But
We tried hard to get Kamala Harris at the top. Didn't work.
well, black men tried and black women tried, but
You can't say all black men or black women. People, they grow up with a certain culture and they just feel that a man should have the dominant role, even though they know better. And as far as black men, they have been eliminated from the very beginning, during slavery and after slavery. And then when they had welfare, they told black women and white women you had to get rid of your man in order to get money and so that your family can live. Then they put the black males in jail more percentage than everybody. There's always been a war against the black male. But even when Hillary was running, women were voting against her because they just feel just like in our churches that I grew up in a culture where it was male dominant, and that's where your comfort level is. Um, we've talked about male and female doctors, and of choice, it was always a male doctor until you got used to, and a few men talked about a female doctor. So hitting that ceiling of about where a woman can get, especially a physician, those top parts, people subconsciously, they always think, and I was part of that too, that a man should be head of it. And that was the American ideal. What country do you know that women are excelling in at the top of everything? We had England where Queen Elizabeth, but we still had Parliament. Um, Maybe Darryl can answer that. I don't know.
Yeah, recently, a recent history, we've had Margaret Thatcher as Prime Minister of England. We have Angela Merkel as a Chancellor of Germany. So this male-dominated society tends to be more of an American thing, where you have a highly qualified woman in two recent occasions with Clinton and Harris losing against lesser qualified men. So, we definitely have a society in this country that prefers male leadership to our detriment.
Jacobin.
Well, speaking from my perspective, there seems to be more women physicians these days than male, and I have only one man doctor. Rest of them are women, and uh, I've seen that in other members of my family, the same thing, and I'm wondering if it's a part of the woman being more compassionate or having more in-depth feelings about complaints and that sort medical complaints and so forth. I just wonder if that has anything to do with that part. But I've noticed that a lot of women are going into the ministry and the medical field.
Well, the truth of the matter is that there are less men in the field of medicine.
Mm-hmm.
And it's all part of some of the aspects of what Carol talked about, in that in many ways we've been kind of genocidal in terms of knocking out the black male. And I'm not sure that we're taking note of it and recognizing it, that in everything, for example, with the education, that's going to impact the black male more than anybody else. Uh, because in this day and age, if you're not educated, you don't know anything about computers, you can't make it in this world. And therefore, if you can't make it, you can go to a different style and your life going to wind up dead or in jail. And that's where too many of our black men are. About 60% of the doctors and of the people in medical school are women. So that we have a decreased number of male medical students, and the number of black males is decreasing. Yes, the women are increasing for whatever reason, and they are more competitive than the men, so this is an observation that we're seeing. Any other comments, John Buchanan?
Yes, I've been with Group Health and Kaiser for probably 30 years or more. I've only had one male primary physician. I've had
Wow,
6 female
wow,
primary physicians over that time. And
wow.
I'll tell you the truth, I prefer I prefer a woman doctor. I do.
Okay, Betty and then Carol.
Yes, I'm thinking that what you've been saying about the male and the domination now that women are coming up and coming physicians, that maybe 5, 10 years from now, it's going to be women at the top because the males are not going to be there.
Carol, you have any comment?
Um, there's a war going on, and we need each other, and that's divide and conquer. It started with our media back in the 40s and 50s and 60s, where you had I Love Lucy, where Ricky is the dominant one, and he can actually beat Lucy. And she was addle brain, father knows best. The male is supposed to be the top of his family. Then you take his jobs away, particularly the black man, and you just crush the family that way. And then it's terrible for a woman to marry if she's a doctor and she marries a custodian, because he's supposed to have more brains than she is, because a woman is supposed to be always addle brain. It's the way the structure of United States is set up that we will never have a female, because the way our media portrays a woman. You see, if you see women fight, I met some woman that was from Russia, someplace at a mall, and she was selling things, but she said she actually fought in the war. And we don't think of women fighting, okay. We don't think of women doing too much, even being a garbage person. And I have to say garbage person. So it's our whole structure, and television and everybody has something to do with how we think. They have shaped us. So if a man is dejected, he has a low paying job, even churches say, woman, you can do better by yourself. You don't take any man that's unemployed and blah, 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 and y'all can't make it. So take a man that has a job, he's worth more than you. You can do better. We talk against each other. So a woman wants a man that's no, if he's no, counter something, I don't want it. And a man doesn't want this woman unless she's subjected to him. We are fighting against each other. And as far as the medical field, this is America. A man is supposed to be in charge of the department. And when it is, then that woman has changed into having male tendencies.
Any other comment? If not, we'll leave this interesting subject. This is the United States Preventive Services Task Force, which is asking Kennedy to preserve the agency the task force relies on. Since Kennedy is about preventive medicine, they are hoping that this will impact. It'll be interesting. I doubt it would be good to see that he who expressed the interest in prevention being more important than therapy, to see if he would preserve this. That would be fitting to what he spoke. The question is, will he not? I don't know. We shall see. But anyway, people are recognizing that if he does not do something about this, then he's been a little bit hypocritical, because most of his emphasis was on prevention, which I think is appropriate. Now, so it'll be interesting to see how he responds to this request, because one of the problems of westernized medicine is too heavily addressing the treatment of diseases rather than its prevention. And this is a change that he talked about putting in place. We shall see, though. Any comments, questions about this article that represents the Preventive Services Task Force, which is where we need to be? John Buchanan.
Yeah, Kennedy sounds like he's dying.
What'd you say?
Kennedy sounds like he's dying. His voice is so distorted. It's like he's sick. He doesn't sound healthy at all.
Any other comments? Now?
Yeah, Robert Kennedy has a medical condition that affects his voice, but has no bearing on his overall health.
Okay. Any other comments? If not, we'll go to the next article. Well, this is something that's embarrassing, that maternal deaths fell 40% globally. Meanwhile, we're afraid that as we cut aid internationally and nationally, that this will result in, instead of the United States continuing to be in a situation where it has one of the highest maternal mortality rates of any developed country. And recognizing that Medicare and Medicaid is likely to be cut, this then does not suggest that this will change our position in the world. Maternal mortality, this is Maternal Mortality Month, a week or a month. And so our U.S. maternal mortality is kind of disgraceful. And the question is, will this new administration result in an improvement, or will things stay the same? We don't know. We'll have to wait and see. Any comments about what the impact of the new administration will be on the national? We know what it's going to be on the global, because it's not going to. We're decreasing our global health impact. But what will it be in the United States, where we have one of the worst? We have the worst maternal mortality rates in the developed countries. Any comments on the expectations? Darryl?
Yeah, a lot of the health research is being hollowed out in the United States by current administration, and so research into diabetes, heart disease, and a variety of other chronic ailments, the research has been stopped by the government. The direct impact of trying to have universities remove DEI from their curriculum. The penalty is they're going to withhold government research funding, which typically goes to a lot of medical research in universities. So it will save a lot of money to the detriment of the overall public. But the goal is to save tons of money to make that money available for tax cuts for the rich, for the ultra wealthy. And so that it's called flooding the zone. There's so many issues that are coming up that you lose focus on. You've got, if you want to protest, you currently have about at least 30, 40 good things to protest, whether it's social security, government cutting government services, funding from the federal government to local school systems. The list can easily get up to 30 to 40. You don't know what to fight, but in the meantime, it's all getting hollowed out to provide the money for tax cuts for the ultra wealthy.
Well, remember you said that, Darryl. Accurate as it may be, you said it. So, any other comments? As this should be our last article, is after 10:30. This is the article I talked about, the new treatment for depression, treatment resistant depression. It was a nasal spray, which is remarkable. So just to let you know that we're making so much progress in many ways. And so just keep in mind, we now have nasal treatment for allergies, for anaphylaxis, and now we have treatment for depression. So made a lot of progress. Okay, I think this will be the last article, and it's after 9:30. I'm sorry, 10:30. So.